The chair now recognizes Representative Tokuda for 3 minutes.
Thank you. Chairwoman Miller-Meeks, Representative Sherphyllis McCormick, and distinguished members of the Health Subcommittee, thank you for including my bill, H.R. 8562, the Parity for Native Hawaiian Veterans Act, in today's legislative hearing, and for the opportunity to speak in support of this important bill. In the United States, there are approximately 614,600 Native Hawaiian veterans, including nearly 275,000 in my home state of Hawaii. According to a May 2022 report by the Veterans Health Administration, Native Hawaiian and other Pacific Islander veterans aged 45 and older experience significantly less access to checkups and routine care than their white counterparts. The report concluded that work is needed to improve the veteran experience of care among Native Hawaiian and other Pacific Islander veterans, and better information could be helpful in understanding and addressing their disparities. They served and sacrificed the same as their fellow veterans, yet our country is failing to meet our obligations to them. More must be done to eliminate needless barriers to care for our Native Hawaiian veterans. That is why I've introduced the Parity for Native Hawaiian Veterans Act to ensure Native Hawaiian veterans can access health care services in a similar manner as their American Indian and Alaska Native counterparts. To fulfill the federal government's trust responsibility to the Native Hawaiian community, it is vital that Native Hawaiian veterans be treated the same as other Native American veterans and explicitly included in federal programs and policies supporting other Native veteran populations. Currently, the Indian Health Service, tribal health programs, and IHS-funded urban Indian organizations can seek direct reimbursement from the VA for services rendered to eligible American Indian and Alaska Native veterans. The Parity for Native Hawaiian Veterans Act would codify the same reimbursement relationship between VA and the Native Hawaiian health systems that have been authorized by Congress to provide comprehensive health promotion and disease prevention services, as well as primary health services to our Native Hawaiians. With more locations near to where Hawaiians live, this is about meeting our veterans where they are at and greatly increasing their access to care. My bill does 3 things. It updates the definition of Native Hawaiian in statutes governing veterans' care and benefits, it eliminates co-pays for qualified Native Hawaiian veterans, and it allows the VA to directly reimburse the Native Hawaiian health systems for care provided to Native Hawaiian veterans. This bill was developed in consultation with Papa Olakahi, which has been authorized by Congress to coordinate and assist healthcare programs and services provided to Native Hawaiians. The bill also incorporates technical assistance from VA and past work by the Office of Hawaiian Affairs. Ultimately, the Parity for Native Hawaiian Veterans Act is about improving healthcare access and affordability for Native Hawaiian veterans and ensuring all veterans are provided the care they need and are entitled to as a result of their service to our country. I look forward to working with members of this committee and Senator Hirono, who has introduced identical legislation in the Senate, to advance this measure forward in Congress. Mahalo, and I yield back.